What is it? Activated charcoal is a form of carbon processed to have small, low-volume pores that increase its surface area, making it highly adsorbent. How does it work for medicinal purposes? Activated charcoal works by absorbing toxins and chemicals in the gastrointestinal tract, preventing their absorption into the bloodstream. This binding capacity is due to its large surface area. When consumed, activated charcoal traps toxins and chemicals, which are then expelled from the body through feces. When was it first used for medicinal purposes? Activated charcoal has been used for medicinal purposes since ancient Egyptian times for water purification and wound treatment. Its modern medical use began in the early 19th century, when it was discovered to be effective in treating poisoning and overdoses. Which conditions and symptoms does it help in men, women, or both? Activated charcoal has been shown in studies and traditional use to help with the following conditions and symptoms. Poisoning and drug overdose for both men and women, as it binds to toxins in the stomach, preventing their absorption. For digestive issues, it reduces symptoms of bloating and gas by absorbing gases in the digestive tract. For cholesterol management, it may help lower cholesterol levels by binding to bile acids. For hangover relief, it absorbs toxins and byproducts of alcohol metabolism. For oral health, it is used in toothpaste to whiten teeth and remove stains. For skin health, it is applied in masks to absorb impurities and cleanse the skin. And for kidney health, it may support kidney function by absorbing urea and other toxins. Which conditions and symptoms does it help prevent in men, women, or both? Activated charcoal can help prevent toxin absorption for both. It prevents the absorption of ingested toxins in cases of poisoning, bloating and gas, also for both. Regular use can help prevent gastrointestinal discomfort, chronic kidney disease, again for both. It may prevent the buildup of toxins in the kidneys. Dental stains, for both as well. It prevents dental stains when used regularly in oral hygiene. And acne and skin impurities, for both. It prevents acne and skin impurities by cleansing the pores. What are the active ingredients that are important for its medicinal properties? The primary active component of activated charcoal is carbon. The carbon in activated charcoal is processed to have a large surface area for absorption. What forms does it come in? Powder, capsules or tablets, liquid suspensions, and toothpaste and facial masks for cosmetic use. What if I have an imbalance or deficiency? Activated charcoal is not used to address nutrient imbalances or deficiencies. Its primary role is to detoxify by absorbing unwanted substances in the gut. For those considering detoxification, activated charcoal may help cleanse the gastrointestinal tract, but it should not replace a balanced diet or adequate nutrient intake. What are possible side effects? Activated charcoal is generally safe for most people when used appropriately, but possible side effects include common, which occurs in 10 to 30% of people, are black stools due to the color of the charcoal and constipation. Less common, which occurs in 1 to 10% of people, are gastrointestinal blockages and dehydration if not taken with sufficient water. Rare, which occurs in less than 1% of people, are aspiration if not administered correctly, especially in children or unconscious individuals, and electrolyte imbalances with prolonged use. What's the recommended daily dose? The recommended dose of activated charcoal varies depending on the intended use. For poisoning or overdose, 50 to 100 grams in adults, 10 to 25 grams in children, administered by healthcare professionals. For general detoxification, 500 to 1,000 milligrams per day in divided doses. For gas and bloating, 500 to 1,000 milligrams as needed. How many days does it take to work? Activated charcoal works relatively quickly, often within 30 minutes to a few hours for acute cases of poisoning or digestive discomfort. Long-term benefits, such as improved digestive health and reduced bloating, can be noticed within a few days to weeks of regular use. What time of day is best to take it? Activated charcoal can be taken at any time of day. For digestive issues, it is often taken before meals or when symptoms arise. For detox purposes, it can be taken in the morning or evening, but should not be taken close to the time of other medications or supplements to avoid absorption. Is it best to take it with or without food? Activated charcoal is best taken on an empty stomach or between meals to prevent interference with nutrient absorption. It should be taken with plenty of water to ensure it moves through the digestive tract effectively.